Today we are talking about the neuroscience understanding of epilepsy. Epilepsy means seizure disorders. So people with epilepsy have recurring and unpredictable seizures. Attention-only chronic repeated seizures can be called epilepsy. How seizure happened? A seizure is a period where cells in the brain or neurons are synchronously active when they are not supposed to be. When they are firing or sending messages using electrical signals relayed from neuron to neuron, are controlled by neurotransmitter. During a seizure, clusters of neurons in brain become temporarily impaired and start sending out a lot of excitatory signals, which acts to the channel receive ions over and over, and this action called paroxysmal. The paroxysmal electrical discharge may be caused by too much excitation or too little inhibition. The main excitatory neurotransmitters in brain is glutamate, and NMDA is primary receptor which responds to glutamate by opening ion channels. On the other hand, the main inhibitory neurotransmitters in brain is GABA, which binds to GABA receptors that tell the cells to inhibit the signal, opening channels let the chloride ions in. There are some factors influence epileptic seizures. First, it is idiopathic, which cannot explain why structural change or metabolic disturbance. Secondary, the factor may be symptomatic, like internal environment changes, infections, tumors, and so on. Third one is cryptogenic, which the clinical presentation suggested symptomatic epilepsy, but no clear cause was found. The last one factor is state-associated epilepsy, like fever, sleep deprivation. What happens when you have an epileptic seizure? During seizure, there are some obvious behavior which can be noticed by others, like jerking, moving, lost consciousness. If we group the form of the seizures, it can be divided to parts according to the region of brain. The focal seizure can be either without impaired awareness or with impaired awareness. The symptoms without impaired awareness are strange sensation by patient themselves and jerking movement. Typically, the patient usually knows that something happened and remember the session work. On the other hand, the focal seizure with impaired awareness may lose of responsiveness and cannot remember what happened during the seizure working. The generalized seizure is both hemispheres of brain are affected. Sometimes a seizure will start out as a focal seizure and develop into a generalized seizure. That's called a focal onset dilatory tonic-clonic seizure. Like focal seizure, there are some symptoms of generalized seizure as well. One symptom is tonic seizure. The muscles are suddenly become stiff, which can cause the person to fall backwards. On the flip side, it can be atonic as well, where the all muscles suddenly relaxed make the person fall forward. The symptoms can be clonic, where they have violent muscle contraction. The tonic-clonic seizures are the most common generalized seizure, where people experience atonic and clonic. Myoclonic seizure are another type, short muscle twitches, sometimes just a single twitch, or vanish in short amount of time. Finally, there are some absent seizures. Patients have some sort of impaired awareness or response missed. If the seizure do last for a longer period, called status epilepticus, if recurs frequently before the onset of full consciousness, the symptoms usually are tonic-clonic seizures if it doesn't return to normal for more than half hour. This situation should be treated immediately, which is treated acutely with benzodiazepine, because epilepsy can differ between the patient and the patient in many types, severity, and frequency of the seizure. The patient history is important. Patient will have brain imaging techniques like MRI or CT scans, as well as EEG, electroencephalogram, which detect electrical signals in brain. Is actually inspection method. Once epilepsy has been diagnosed, it is often treated with daily medication, the primary form of medication being anticonvulsants, like sodium valproate, carbamazepine, depends on patient age, region of brain affected. Other treatment options include epilepsy surgery, where removing some caused seizures, like tumor. Nerve stimulations may also be considered, which control seizures by influencing neurotransmitter released. Thank you for watching this video.